Hello everyone, welcome back to our channel. Warning, 15 sleep symptoms that could be early-stage diabetes. Did you know? More than 50% of people with diabetes don't realize they have the disease until dangerous complications appear. But what's more worrying is, many of the first signs don't come during the day, but appear silently during sleep. Sleep is not simply a time to rest, but a silent mirror reflecting internal health. Many nighttime symptoms are whispers from the body, warning that something is wrong with blood sugar metabolism. Diabetes is not loud, not easy to detect, but it quietly attacks every cell, and sleep is the first place it leaves its mark. This video will help you explore 15 dangerous signs at night, small signs that can save you from major complications if detected in time. Part 1. Chronic insomnia. A diabetic once shared, "There are nights when I can't sleep for more than 2 hours. My mind is tired, but my eyes are wide open." This is not surprising. When blood sugar fluctuates, the body releases adrenaline, a hormone that wakes up. Along with that, the hormone cortisol is disrupted, creating a cycle of fatigue. According to the journal Sleep Medicine Reviews, sleep disorders occur in more than 50% of people with type 2 diabetes. To break this chain, the best way is to stabilize blood sugar before going to bed and maintain a regular sleep schedule every night. 2. Hypoglycemia at night. There is nothing more terrifying than waking up shaking, with a racing heart and cold sweat soaking your back. Hypoglycemia during sleep is the silent culprit, especially common in people using insulin or diabetes-lowering drugs. A report from the American Diabetes Association (ADA) warns about 50% of severe hypoglycemia episodes occur during sleep. The solution is not far-fetched. Measure your blood sugar before bed, have a snack if necessary, and use a CGM to monitor your blood sugar overnight. 3. Unconscious teeth grinding. Did you know? Some dentists have found that patients who grind their teeth while sleeping have a higher rate of blood sugar disorders than normal people. The reason is because of nervous tension due to low blood sugar, causing the facial muscles to react with uncontrolled repetitive movements, usually grinding the teeth. In addition to a mouth guard, you should practice light relaxation before bed, such as listening to slow music, massaging the jaw area, or soaking your feet in warm water. 4. Frequent urination. Many older people think that nocturia is normal, but if you have to wake up 2-3 times every night to go to the bathroom, it is a warning of high blood sugar, causing the kidneys to work overtime. When glucose exceeds the threshold that the kidneys can filter, the body is forced to excrete it through urine, and you pay the price with sleep. The National Diabetes Institute recommends that this condition not only affects sleep, but also increases the risk of dehydration and chronic kidney failure. 5. Nighttime cramps. Suddenly waking up because your calf feels twisted. You curl up. The pain is so bad that you can't even scream. It's not just a lack of exercise. People with diabetes are prone to potassium, magnesium, calcium deficiency, or peripheral nerve damage, leading to muscle cramps while sleeping. A study in the Journal of Diabetes and Its Complications showed that 30–40% of type 2 diabetics experience nighttime cramps at least once a week. Supplement minerals through food or pills as directed, combined with gentle stretching movements before bed. 6. Sleep reflux. Have you ever woken up in the middle of the night with a burning sensation in your throat, like acid rising from your stomach? This is more common in people with diabetes due to autonomic nervous system disorders, causing the stomach muscles to contract slowly, causing food to stagnate and reflux gastric juices into the esophagus. The Journal of Gastroenterology notes, up to 30–40% of people with type 2 diabetes experience this condition. Try small but helpful changes. Eat dinner 2–3 hours before bedtime. Avoid spicy fried foods. And if necessary, elevate the head of the bed to support gravity's natural ability to prevent reflux. 7. Irregular heartbeat. Have you ever woken up with your heart pounding, strong and pounding, feeling like you've been jogging in your dream? It could be your heart's response to fluctuating blood sugar or electrolyte imbalances like low potassium, magnesium. But it doesn't stop there. This phenomenon can be an early sign of diabetes-related cardiovascular damage. Many studies show that people with diabetes are 2–4 times more likely to develop heart disease than people without diabetes. Don't take it lightly. Check your evening blood sugar, supplement essential minerals, and limit stimulant drinks after 5 p.m. Restless legs, lying down but feeling restless in the calves, the urge to move, unable to sleep, that is a typical symptom of restless legs syndrome, RLS. In people with diabetes, this symptom is often related to peripheral nerve damage or iron deficiency, sometimes the result of dopamine transmission disorders in the brain. Although not immediately dangerous, RLS silently erodes the quality of sleep every night. A gentle but effective solution is light exercise in the evening, avoid drinking coffee, and take iron, magnesium supplements as directed by your doctor. 9. Vivid and intense dreams. Vivid dreams are a beautiful gift, but when they turn into intense nightmares, they can be a wake-up call. People with diabetes can have terrifying dreams due to fluctuations in blood sugar at night, or sleep apnea, OSA, which causes sudden stimulation of the brain. According to the Mayo Clinic, OSA occurs in nearly 50% of people with type 2 diabetes, causing constant sleep interruptions, leading to nightmares. Don't rush to reach for sleeping pills. Start by dimming your screen before bed, reading a few pages of a relaxing book, and practicing deep breathing to calm your nervous system. 10. Thirsty in the middle of the night. Do you often wake up and fumble for a bottle of water? Thirst at night isn't simply due to the weather. It could be the result of high blood sugar, which causes the kidneys to constantly excrete glucose, which in turn leads to water. The result, dehydration, thickening of the blood, and even more thirst. This is an early sign of prediabetes or type 2 diabetes, warns the Society for Clinical Endocrinology. Be proactive in drinking enough water during the day, avoid storing fluids in the evening, and monitor your blood sugar regularly if you find yourself unusually thirsty. 11. Numbness and pain in the feet at night. There are nights when you can't sleep well because your feet feel like they're being pricked by needles, aching and aching. The numbness spreads to each toe, forcing you to massage it for a long time to relieve it. This could be a sign of peripheral neuropathy, a common consequence of diabetes when high blood sugar over time destroys nerve endings, especially in the lower limbs. According to the British Diabetes Association, 1 in 3 diabetics suffer from peripheral neuropathy within the first 5 years. Careful foot care every day, combined with light exercise such as yoga or slow walking, not only helps relieve symptoms, but also prevents dangerous foot ulcers. 12. Nocturnal blood pressure. Normally, your blood pressure drops at night to help your body rest. But if you live with diabetes, your blood pressure may suddenly rise again during sleep, a condition called non-dipping. This comes from autonomic nervous system disorders, which cause the cardiovascular system to not regulate its resting rhythm, especially when blood sugar drops slightly. The body will react by constricting blood vessels, causing blood pressure to rise. According to the journal Hypertension, this phenomenon is closely related to the risk of early morning stroke. Take your blood pressure at night if you suspect it. And remember, reducing salt, avoiding canned and processed foods, are small changes that can make a big difference. 13. Sleep apnea. Not everyone who snores loudly has sleep apnea. But if you regularly wake up feeling breathless, have a rapid heartbeat, or feel tired for no apparent reason, be alert. Obstructive sleep apnea OSA not only causes temporary brain oxygen deprivation, but also worsens insulin resistance, increasing the risk of heart attack and stroke. A study by the American Diabetes Association found that more than 50% of people with type 2 diabetes have OSA without knowing it. If you are overweight, start by losing the first few pounds. Even losing 5–10% of your body weight can significantly improve your condition. Also avoid alcohol or sedatives in the evening. 14. Night sweats. Have you ever woken up in the middle of the night drenched in sweat, even though it's not hot outside? This could be a sign of hypoglycemia during sleep, which causes the sympathetic nervous system to work harder to alert the body. In addition, nerve damage from diabetes also disrupts the temperature control system, leading to irregular sweating, especially in the upper body. If this happens again, you should measure your blood sugar at night and adjust your dinner to balance starch, protein, fiber. Don't forget to adjust the room temperature to a comfortable level and wear breathable clothes to make sleeping easier. 15. Early morning headaches, waking up with a dull ache in the forehead or temples, accompanied by fatigue and dry mouth. This could be the result of a lack of oxygen to the brain due to sleep apnea, nocturnal hypoglycemia, or silent dehydration. Many people with diabetes experience this condition, but it's easy to mistake it for stress or lack of sleep. According to the Stanford Sleep Medicine Center, poor sleep quality is the main cause of morning headaches in people with diabetes and prediabetes. The solution starts with maintaining body moisture during the day, not drinking too much water late at night, and creating a stable sleeping environment, quiet, soft light, good air circulation. There is something that few people pay attention to. What happens while you sleep is a silent map of your metabolic health. Every disturbed dream, every time you wake up thirsty, numb feet, or a rapid heartbeat, are drawing important question marks about your blood sugar, nervous system, and cardiovascular status. Unfortunately, they are often overlooked because they are too small, too familiar, or simply because we do not think that health can speak at night. However, sometimes just a seemingly trivial sign is the first warning of diabetes, a disease that progresses silently but deeply affects the quality of life, especially in the elderly. You don't have to wait until symptoms become obvious. You can take action right now. Start by paying more attention to how your body feels when you wake up. Do you feel tired? Do you have cramps, dry mouth, or a slight headache? These small details will help you understand yourself better every day. And if you have experienced some of the above symptoms, don't hesitate. Try recording the abnormalities that occur at night in a small notebook. This will not only give you a clearer view of the frequency and severity of the impact, but also be a very useful document when you see your doctor for a comprehensive assessment. At the same time, consider measuring your blood sugar at key times, especially before bed and after waking up, to detect abnormal fluctuations early. Sleep, although seemingly simple, is an invaluable foundation for a healthy body and a journey to live a long, deep life. When sleep is protected, your internal systems, from the nervous, cardiovascular to endocrine systems, are also cherished and restored. Conversely, if every night is a silent battle with unnamed symptoms, the quality of life during the day will gradually erode. If today's sharing makes you think, take a few seconds to follow the channel, because here you will always find reliable, easy to understand, and practical medical advice designed specifically for the elderly and those who are caring for them. And if you have ever had a memorable sleepless night or a symptom that worries you, leave a share below. Who knows? The story you tell will be the awakening for someone who is silently suffering. Don't wait until the disease is obvious to take action. Start tonight with a sleep that is listened to and protected, because health does not begin when you wake up, but when you close your eyes.